Welcome to the Salt Health Podcast, the intersection of primary care and functional medicine. We bring decades of expertise to empower you with free, life-changing education so that you can live healthy, make wise decisions, and thrive. Today, I am here with board-certified family practice doctor of nursing practice, Jacob Ponder, and certified functional medicine provider. I am excited to be here today with you to talk about your journey into functional medicine.
Glad to be here.
Jacob has years, decades of medicine experience and education in medicine. He has a fun previous career that helped lead him into the medicine world. So I just wanted to talk to you today about that.
Sure. So originally when I went to college, I got my first degrees in political science and mass communications. I think broadcast journalism was the goal. That turned into a desire to focus more on the entertainment aspect of broadcast. So after I graduated, I did have a stint as an actor doing some national commercials and TV shows and things like that. As I got older and through that process, I started to take my health a little more seriously. I grew up the son of a pharmacist, and so I was always around healthcare, and probably for that reason rebelled a little bit from being around medicine. But I guess there's a part of it that's in my blood as well. So as I started to take my health, fitness more seriously in my mid to later 20s, I started to realize that I was able to shut down this negative self-talk that told me I couldn't do something. And that was a real big epiphany for me, that I was in control of a lot of the aspects of my own health. I was ready for a career change. I was hitting my 30s, and I wasn't as fulfilled professionally as I thought I would have been. And so I started to reevaluate. That's where healthcare started to come to the forefront of my thought. As a result of that, I knew that I wanted to do something specific. I wanted to combine this health psychology, exercise science thing, and I didn't really know what that was at the time. But I knew that I wanted to become a resource for other people who might have also experienced needing to overcome obstacles of their own health journey, to kind of work on that, negative self-talk. Realize that you're able to accomplish a lot more than you ever realized. Through that process, the route that made the most sense to me was nurse practitioning. And I knew that family practice was something that I wanted to do because I wanted to hit all the ages. I wanted to be there for the kids. I wanted to be there for the older adults. I also early on knew that I wanted to do something different from an individualized approach. I even thought about the old days where you would do like house calls. Not that I wanted to do a house call, but I wanted to be able to be available from a standpoint of just accessibility.
Meet people where they are. You're not the same as the next guy. And so we're going to kind of walk through that together. Through that process, and this is even before I was really deep back into school, I ran across the concept of concierge medicine as a result of that. And I thought that was interesting. And then even back then, this was over a decade ago, that correlated me into functional medicine. And I remember filing that away in my brain of that sounds exactly like what I'm wanting to do. That I had to go to school. So we spend lots of time going back to school. I had to go back to a bachelor's program, get my nursing license while I worked in med surg in the hospital. I took one semester off and immediately went into the grad program. And then over 10 years ago, graduated as a nurse practitioner with my master's. Worked a little bit in urgent cares just to kind of hone in on the acute care. And then at that point, it transitioned into more of the chronic disease management at a large teaching hospital in the state. It didn't take long for me in that realm to realize this wasn't really what I had signed up for. I just felt like the expectations were to treat the symptom with the medication, knowing that may not be effective enough. So we're going to have to increase the medication. And then I saw that we're going to have to add more medications on top of that medication. probably because those medications are causing other side effects as well. And it was this snowball effect that was quickly within the first few years made me realize this is exactly what I wasn't really wanting to get into. At the same time, my sister, who's also a pharmacist by trade, was getting more involved in the notion of functional medicine. And that relit that bulb in my head of this was something that I remember going back to even before I'd started, my graduate program. So about 3 years into my practice is whenever I dove into studying functional medicine through the Institute for Functional Medicine. And as I started to do that, I started to incorporate just basic lessons that I was learning in those courses into my patient population. And a lot of it was met with intrigue. It made sense to them. But something else that happened in that time, I feel like as a provider, as a nurse practitioner, I did spend a little more time explaining things. Maybe it was the nursing background, spending more time with the patients. And so that was expected. My patients knew that. But then as I started to provide alternative options for treatment that were lifestyle related, maybe let's think about the foods that we're fueling our body with. Maybe let's think about the toxins that we're introducing into our system. Maybe let's think about eliminating some things that could be inflammatory. It was a very mixed reaction because I wasn't meeting their expectations of I've got this problem right now. I need the quick fix and I need to get on with life. So I joke that I typically had a pretty good satisfaction rate among my patients, but I had a little series of complaints. And I met with my advisors and they were like, we don't understand what's going on. This isn't typical of what's happening with you. But we're getting comments about he's coming across very maybe aggressive, I think was the term. And I realized it was the passion that was coming out in I have other options for us to try as opposed to the things that I know we've tried multiple times and aren't working. And that was met with kind of some negativity. So I, at that point, knew that I needed to switch my focus a little bit. I needed to calm it down. And then I needed to realize my approach to functional medicine may not be yet desired by this specific population. And then I should probably start to maybe tweak that a little bit. During that time, I was teaching grad students also. And the College of Nursing, since I was teaching doctoral students, they said, you need to get your doctorate as well. And I said, on one condition, there's, the big thesis, the big project that you work on through that process, as long as you will approve me being able to focus my study on functional medicine, I will come on, spend more time teaching. And they agreed to that. So while I started to teach full time, still keeping clinic hours, COVID also hit. I'm spending part of my time in the clinic, part of my time in the drive-through garage, triaging COVID patients, and then trying to teach grad students through video because the day that I started teaching full time, they got kicked out for COVID. So it was this really crazy time of life. I started to work on my project focusing on my approach to using functional medicine tools to treat hypertension and diabetes in my patient population. That was approved, and I got to work. And through that process, I realized that I needed coursework only gets you so far. You need real world functional medicine experience. And as you know, there's just not a lot of people out there who are doing that. And so I realized that I needed to find a mentor in functional medicine to help guide me through this process. And an online search led me to Salt Health, where I think you guys were looking for a new provider at the time. I wasn't necessarily looking for a new job, but I thought, well, if I can just get my foot in the door, I'll come up there for free and just spend some time if they would allow me. And then one thing led to another, and here I am now. But I was able to successfully complete that project based off of the knowledge that I was finally able to, and real world experience I was able to gain. And it did show major improvements, especially in my hypertensive population in that clinic who were willing. The difference there was that they signed up as opposed to me just approaching all of my patients, recommending these lifestyle changes, recommending root cause approach. These people were actually hungry for it. And so that was the big turning point for me, is realizing that we have to have an understanding that there are other options out there from a primary care preventative standpoint. It's not always the quick fix. It's going to take a little bit of investment in our own health, and you have to be willing and ready to make those changes as well.
Well, first of all, let me say Salt Health hit the jackpot when we were able to bring you on as part of the team, especially because you're so unique, because you do have so much primary care experience. And so it's that hands-on knowing the patient from birth to death that, I mean, is so unique and vital, because we're not just one appointment or, a series of 6-month appointments. We have a whole life that we want to live healthy. And so bringing that functional medicine knowledge and view and root cause medicine into primary care, is what Salt Health is all about, and living that out. So if you could, give your definition. I know you've seen functional medicine in and of itself, just by itself. And I know you've seen primary care. Tell me how you view the blend.
Primary care is necessary. We know enough now that there are things in place that can help prevent disease from happening. If disease does happen, there are ways that we can treat that. I think where primary care, traditional, conventional care, however we want to label that, comes in really good is through the acute care needs. We have an infection. We know there's lots of risk associated with certain infections. That's where potentially a medicine, if need be, comes in very handy. However, what led us to getting the infection? Was it because our immune system was compromised, because our gut was off, or we have some genetic factors impacting our immune response, or we have nutrient deficiencies that are not allowing our body the resources that we need to be exposed to and fight infection? So that's where the functional medicine part really comes in and allows us to start from the ground and work our way toward optimizing, having that primary acute approach when necessary for the more significant life-threatening issues.
Well, one thing I love about you and Dr. Herbst's approach is you sit with the patient and you're almost like detectives in collecting clues.
Because investigation is my favorite.
Yeah, he's very much a scientist. Because it's that investigation of picking up on clues that maybe as a patient, I don't even know is a factor.
Right.
But because you're taking the time and you're focusing on me and you're listening, you're not just assuming XYZ about me or assuming this is the path, the best path of care. And then also that relationship of, meeting me where I am as a patient, of what am I able to implement into my life? Where am I in my knowledge? Where am I in my passion? We're all on this journey, right? And so that is such an important part of your style of care that I really appreciate, that I think is a big part of how we integrate that.
That is, it is the most gratifying aspect of what we do. I'm going to speak for both what I do. Getting to sit down with our patients for an extended period of time, going through their whole life history, starting from the day they were born, sometimes even factors that happened before they were born. Cut to decades later, they're having a specific issue. I'm able to go back through their whole life history and a lot of times see this pattern that led to what brought them in that day. And it just changes the approach. It's not the quick, okay, oh, well, you have the symptom, here's the pill that's going to fix it. I see based off of, let's just take all of a sudden you're having these migraines and you had not really had these migraines before. well, I know that you're having maybe some irritable bowel issues 10, 15 years ago that weren't addressed. And so maybe even something like a headache or chronic sinus issue or whatever it is could be traced back to that immune dysfunction that was never built from a gut standpoint. The gut became leaky. It started to create leaky brain. And so leaky brain became symptomatic for someone through migraines. And so we're able to go back and kind of rebuild their immune system from the ground floor through nutrients, through closing intestinal permeability. And then that way their body is able to absorb the nutrients they need. It's not missignaling neurotransmitters up into the brain and causing, either headaches or mood issues or whatever it is. So that is the wonderful part about having the knowledge of like, okay, how can we treat something in the moment right now, but how can we prevent it from recurring down the road?
Yes, which is so important, especially as we age. Yes. And not waiting until, as I say, as the wheels fall
Absolutely.
off.
Yeah.
Is, all the things we can do beforehand.
People think, well, things happened to me in my 40s and my 50s. Well, most likely they've been brewing since you were a kid, a teenager, and we're resilient, and we don't listen to those things. And so that's where I think true prevention comes in as well. And I love it when we get the little kids, because we can start them from a level where we were never started, as at their age. So we can teach them to the point where they'll listen and where they'll want to, maybe make some changes to their lifestyle from not eating the way that other people ate growing up and getting the fast foods and the sugars and all that stuff, but actually giving their body the nutrients and defenses they need to prevent stuff 10, 20, 30 years down the road.
I mean, personally, when I'm bringing in my kids, right. I always have them in with the appointments with me.
Yes.
Because you're so good at helping explain it to them. It's much better than mom dictating.
They don't want to hear it a lot of times from their parents.
They don't want to hear it from mom. But when they are a active participant in their own care, when they can see their own test results, when you can pull up that GI map or, that Nutri-Eval and say, hey, look, guys, you're having these issues. Man, it's so much more real. And we have a huge population of kids at Salt Health, and it just makes my heart happy. So
I know. I think of acne, acne in kids, and we're like, okay, well, it's puberty and going through it. Well, yes, there's some changes happening there, but then a lot of times it goes back to immune function, gut health, food sensitivities, and stuff like that. And so if we can start that education at a younger age, then they're going to be a little more inclined. But I'll also give them the option that they choose, so I can say, well, this is what we know based off of how the gut and the things that we eat impact the skin. And you don't correlate those things typically. And so they can choose to make the changes, or they can choose to, still struggle with the acne and the everything that goes along with it.
Choose your hard.
Exactly. Yeah.
First, tell me, what is low dose allergen immunotherapy?
Low dose allergen immunotherapy, we'll just call it LDA, just to shorten it, is a different mechanism to help those patients struggling with allergies. And that's across the board allergies, whether it's environmental, seasonal allergies, food allergies, chemical sensitivities, and things like that. The difference between your traditional allergy shots, which most of us know about, is in the past, we have done allergy testing. I think a lot of people will go get their skin tests done, where they poke lots of holes in the back and put in different potential allergens and see what they react to. So you're essentially finding specific allergens that are causing specific reactions.
In environmental allergens.
Environmental, correct. They don't do testing for foods in that regard. So there's really a whole section of allergens that are being that are unable to be treated through that form. Low-dose allergy immunotherapy is more of a comprehensive approach to creating some desensitization to allergy responses. The easiest way for me to explain that is where traditional allergy shots are essentially cherry picking the few things that you respond to. Formulations are made for those specific reactions. And then over time, you're getting shots sometimes up to 3 times a week, every week for months, years to work on reducing your response to those offenders. The problem that's happening is that a lot of things are getting missed. So that's where LDA comes in. LDA was created as essentially back in the 1960s. It initially was called enzyme potentiated desensitization by a British physician named Dr. Leonard McEwen. After that was taken over by Dr. Butch Schrader here in the United States, where most of the current LDA protocols are based on. And he's adapted the work of Dr. McEwen to create what we use now as the LDA therapy. It works differently on our immune function. So where we talk about traditional allergy shots, kind of cherry picking the few things, with LDA, you're hitting a different function of our immune system where you're almost rewiring your immune system from Treg cells that can hit much broader categories. The three most common categories that we see or that we treat are inhalants, which include grasses, trees, molds, animals, pollens. Yes, obviously here it's a big one. Mm-hmm. Then there's the whole food category as well. And that is all foods, not just specific foods.
Okay.
And the third one that we do a lot of is chemicals. So people who are sensitive or allergic to bleaches or perfumes or things like that nature, plastics and stuff, that also helps in that category.
Wow. So this is a therapy, whereas before maybe there weren't a lot of treatment options, or maybe they weren't very effective treatment options.
Right.
And you've seen success?
In my practice, you hear, I did allergy shots as a kid and they didn't really work that well. Well, now we understand it's probably because they were missing a lot of cross-reactive types of allergens. So they were hitting the ones that we knew of, but they were missing all the other environmental factors or all the foods and things like that we weren't able to treat.
Okay. Wow. So tell me how just the process of these shots are different from the old allergy shots or drops.
Yeah, good question. When you are getting your traditional allergy shots, like I said, you're going in sometimes starting off every 3 days a week up to every week, getting shots done, slowly building a resistance to the things that you tested for. With LDA, you are rewiring your immune function based off of the certain categories that you're most responsive to. It is a shot as well, but they are subdermal shots. So if you've ever experienced like a TB skin test, they're very shallow insertions of a very small amount of essentially microdosing of these categories of allergens.
That have been personalized.
They're included with an enzyme that helps deliver that to the tissues, to the cells. And over time, that's what starts to kind of reprogram, rewire for your body not to register those things as offenders that are amounting that allergy response.
Okay. Wow. So you still have, it's still a shot, maybe a little more shallow, as you were saying.
Correct.
But it's very personalized and very specific for your allergens.
Well, not the categories are specific. So if I'm going to get inhalants, you got inhalants as well, we're getting the same shot. It's just covering all inhalants. It's not just, you tested positive for ragweed and a certain type of mold and a cat. It is all animals, all molds, all pollens, all grasses.
Gotcha.
Yes.
Okay. That makes sense. So, how long is the span of this therapy?
Starting off with LDA, you get the shots every 8 weeks. So as opposed to weekly or multiple times a week, you're going to go 8 weeks in between. Typically, we'll do the 8-week intervals or the 2-month intervals for 5 to 6 sessions. So for about a year, there's about a 70% improvement rate reported within the first therapy or two, and then just slowly building over time that immunity toward those allergens. At the year mark, usually starts to reevaluate, and we can pull back to every 3 months, every 4 months, every 6 months. Some people are dosing it just for maintenance once a year or 18 months.
So you're teaching your immune system to fight all of the allergens.
Correct. Not to see them as offenders, not to trigger the histamine response, to calm down the fire that being exposed to these things are setting for your body.
Who have you seen these shots help the most?
We have lots of patients with, across the board, their body's response just over the years, whether it was genetic components or their gut health kind of mounted a response to histamines. They grew up in moldy environments. They've got autoimmunity, things like that. They're having a hard time eating multiple foods because they're reacting to them. They are chronically having allergies, symptoms throughout the year, not just seasonally. Those people are getting the biggest response, just to where they notice improvements as the seasons change pretty soon after they've started the therapy themselves. We have all ages do it, kids up to older adults. Kids typically, being more resilient, are going to respond a lot faster than adults who've kind of been living in the storm, for so many years. But they're also starting to see improvements, and they even will, they'll have hiccups along the way with other aspects of their health, but they also come back and say, I know the LDA is helping me. I know they can tell pretty soon.
Pinpoint it. Mm-hmm. I know the salt health way. I know a lot of gut health is related to allergens. How does that play a part in it?
It's just our overall body's immune response. So, a lot of times when we're young, that's when we see a lot of the allergies develop, the eczemas develop, the asthmas develop. And whenever I hear that triad of symptoms, I think, okay, there's immune dysregulation. Maybe they were born prematurely. Maybe they didn't get the nutrients that they needed. Maybe they were born cesarean section, didn't get that, that squeeze. And that, for whatever reason, mounted some sort of immune dysregulation. Oftentimes at that young age, it's going to start in the gut. So on top of calming down response to these allergens, obviously working through GI protocols, getting a robust GI system healing is going to help in tandem with LDA.
Awesome. Do you have to be a Salt Health member to take part in these therapies?
Currently, we're only offering these services to LDA just because it is fairly new to our clinic. As we become more comfortable, as we're able to monitor our patients, our members on how they're responding and getting the positive feedback, we will start to roll it out to non-members. The difficulty with LDA that we haven't discussed yet is that it is pretty cumbersome from a patient standpoint, only in the fact that it does require a lot of work on the front and the back end of the shot themselves. For example, someone who's having to, depend on antihistamines leading up to fall or spring, we require them to come off of those antihistamines a week before the shot, and they have to stay off of them for 3 weeks after the shot. Well, that's difficult for some people to get through those types of seasons. So we try to time the shots to where we're hitting that, a few weeks before allergy season is starting to happen. And the reason why we do that is that there runs a risk of taking an antihistamine, which could essentially cancel out the shot. So it makes it less effective. For those patients who are desensitizing to foods, multiple food allergies, we have to be careful not to unnecessarily sensitize them to foods that they may have not been reactive to before. So there is specific things that you can eat the day before, the day of, and the day after that we require you to adhere to, just because we don't want to cause an allergic response to something that you were totally fine with before. So there's those kinds of ins and outs. There's certain medications that you can take and not take before and after, certain supplements that you can take during, but certain ones you have to hold off for a while. And we can walk you through those things. That's where it gets a little more individualized with our patients.
So the individual needs to be committed to this.
Absolutely. Yeah.
But, a lot of times, like a lot of the functional medicine things, it's like you do the hard thing up front and it's worth it on the backside. I got approached by a mom whose kids are on it and she's on it and they have awful seasonal allergies. And she was talking about, well, it was a pain to keep the whole family away from certain foods for those, very important days. but they can see so much of a difference this fall as they've gone into their allergy season. And her kid was out playing on the baseball field and rolling around the leaves, and he didn't seem to be having any issues.
Huge. Yeah.
So, I mean, if you can have, have a little bit of that pain for the game.
Exactly. And kids will come in and they'll complain, and it's not that they're not able to eat foods. It's that they don't like to eat the same thing for 3 days in a row, essentially. So you're definitely not going to starve. One thing that we haven't talked about is the safety of LDA. With the traditional allergy shots, a lot of people aren't eligible to get them because they have a history of severe asthma, or they've had history of anaphylactic reactions to those allergens. They won't allow you to desensitize from those. With LDA, because it works differently, it's again rewiring the immune system. It's not specifically targeting these allergens. It is the safest, most effective way of desensitizing at this point. There's no history of negative outcomes, negative reactions to the LDA shots themselves. So by and large, it is proving to be a lot more effective and a lot safer than the traditional route.
Awesome. Win-win.
Absolutely. Cost effective also. Insurance isn't going to cover allergy shots through the allergist. It's considered elective. LDA is significantly more affordable over the span of time. If you average out what you're going to spend on allergy shots per year, clinic visits, things like that, versus the LDA shots, it's going to be significantly less as well.
So if you're tired of the Band-Aids of antihistamines with the changing of the seasons,
we don't have to keep testing we don't have to keep testing for allergies. We don't have to keep poking kids unnecessarily. It's just, if you can get over the hump of the restrictions leading after, it's so well worth it.
Can you give me an idea of why you got interested in this to the beginning? Did you see a great need? Did you have a specific case that pushed you in this direction?
We have a few patients at Salt Health who have done LDA therapy for years. And so that got it on our radar. So after I was able to look into it and realize that there's a program where qualifying practitioners can do the study and certify, we then realized that there's no one in this area who provides this service. More specifically, most of the patients that we'd had to travel all the way to Oklahoma City. So by going through the training program, taking the exam, certifying by the American Academy of Environmental Medicine, I'm now able to be the only provider in Arkansas that I know of who's able to give LDA injections this way.
Do you have any final takeaways?
One of the things that we do at SALT is really look for more of that root cause approach. Now, is LDA root cause? No, but it is taking care of your body's response from a root cause standpoint from many different factors, which we know are individualized by each person, that have created them to have an immune response to multiple allergens. So this gives us a lot of hope for the future of our patients and their response to overall histamine intolerance, as opposed to taking one approach that is showing not to be as effective as I think we all hope it would be, that there are other options out there that are targeting more of a comprehensive, categorical response to calming our body's burden down from an allergy standpoint.
If you could change one thing about the current healthcare system, what would it be?
One thing. Wow, that's a tough one. I'm going to go back to expectations. I think the current conventional model of healthcare is a model of enabling. So I think that there's the expectations of, I've got this issue, whether it's an acute, chronic thing, I am looking for the quick fix. And as I've said it multiple times, true healing takes time. It's not an overnight process. It's so gradual that sometimes you forget about them. You forget about the things that you were feeling. So that's, and I think it's such a fast-paced environment where you're not given the time with your provider to really dive into the root. It's looking for the Band-Aid, the quick fix. That has become the expectation, not how can I, what led to this, or what can I do to prevent this in the future? That's my biggest frustration.
Well, we keep doing our part.
That's right.
Thank you for being here with me today. We appreciate it.